All right, welcome back, everybody. We're diving deep today
Deep.
into clinical notes.
Yes.
Which, on the surface might not seem super exciting.
Yeah.
But
Yeah.
they are. And we're going to find out why today with our expert.
Happy to be here.
So we're looking at this source material, a guide. It's fascinating. They make this point that writing clinical notes is really about caring for the patient, like right now, today, but then also in the future, tomorrow.
Yeah, it's a plan, right?
Right, like a plan.
Both for now and for later.
Exactly. So let's start with the today aspect of that.
Yeah.
What jumps out at you as the biggest immediate impact of a good, solid clinical note?
Well, first off, you're setting up a game plan.
Okay, yeah.
You're laying out what needs to happen right now. A well-structured note, it just makes everything so much clearer.
Yeah, for everyone involved, right?
Exactly. You're setting those goals, you're laying out the timeline for care, and you're making sure everybody's on the same page about the diagnosis, especially when you're working with multiple providers.
Yeah, it's like you don't want people going off in different directions.
No, not at all.
You need that shared understanding.
You got it. And that's where patient safety comes in.
Okay, right.
Big time.
The guide talks about minimizing errors.
You think about things like allergies,
Oh, yeah.
medication,
Fast reactions on.
all that. If it's documented clearly, that can be the difference between a good outcome and something going really wrong.
It's like almost life-saving. Right.
From record.
Yeah, like a safety net woven right into the system.
A safety net, yeah. I like that.
Right.
But then the guide goes on to talk about, the financial side of things, which I thought was interesting. Like, good notes can actually support, appropriate compensation, getting paid.
Oh, for sure. Because it's all about justification.
Right. You need that clear documentation to show why a certain level of care was necessary, right?
Mm-hmm.
That's how you back up your coding and billing.
Yeah.
And then the whole process goes so much more smoothly when you have that organized record.
So it's like a win-win.
Totally.
Yeah.
It's good for the patients, good for the practice, makes everyone's life a little easier.
Exactly. So we've talked about the today aspect, the immediate impact. Now let's zoom out a bit and think about the future.
The tomorrow, huh?
The tomorrow.
Mm-hmm.
Our source material has this great line: the quality of future care could hinge on the quality of today's notes.
That's powerful, isn't it?
Yeah, it really stuck with me.
It makes you think. Because those notes, they don't just disappear, right?
Yeah.
They become part of that patient's permanent medical history.
Well, yeah, for years.
Forever. So even if you never see that patient again, somebody else will.
Wow, that's a good point.
And those notes will be there to guide their decisions.
Like you're contributing to that patient's care down the line, potentially.
Exactly. And you're not just influencing individual doctors.
Okay.
Think bigger picture.
Okay, yeah.
Research.
Our research, yeah.
Years from now, those notes could be part of a study that leads to a breakthrough treatment. It's amazing to think about.
Wow, that's kind of mind-blowing.
And of course, there's the legal side of things too.
All right.
Clear documentation, it's your best defense if a case ever comes up. It shows you were thorough, you were careful.
So it's like protecting yourself as well.
Exactly.
All right, so we've talked about the impact on present care, future care, even legal implications.
Yeah.
But there's this other piece that I found really intriguing.
Oh.
It's the impact on the patient's experience.
Interesting.
I know some providers are a little hesitant to share notes directly with patients.
Yeah, I get that.
But our guide actually suggests that it can be really beneficial.
In what way?
Well, talks about transparency, building trust.
Yeah, that makes sense.
When patients can see what's written about them, it can actually make them more engaged in their own care.
More engaged, huh?
Yeah, they understand their condition better. They feel empowered to ask questions, to advocate for themselves.
That's a good thing, right?
Absolutely. And it also makes communication with their family and other providers so much smoother.
Oh, yeah, for sure. Less confusion, more clarity all around.
Exactly.
But
it's like giving patients a seat at the table.
I like that analogy. They become active participants in their own healthcare journey.
Yes. And then there's the impact on your professional reputation. Detailed, well-written notes. It sends a message to your colleagues and your patients.
What kind of message?
That you're thorough, you're thoughtful, you're invested in their well-being.
It's like building a brand of excellence, right?
Exactly. It all comes back to quality.
Yeah.
So I think what we've really uncovered here is that clinical notes, they're not just a chore. They're not just a box to tick.
No, not at all.
They're a powerful tool.
Absolutely.
With huge implications for patient care, for communication, for professional development even.
It's all connected.
Yeah. So for anyone who wants to dig deeper, we've got a link to the full guide down in the episode description.
Check it out.
And as you go back to your practice, think about that next clinical note you write. How can you make it even more effective? How can it better serve your patients? And how can it elevate your practice as a whole?
Great questions to ponder.
Until next time, keep diving deep. More information in the description.
See you then.
Bye.
Bye.